Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, now we have pathophysiology of the hiatus hernia. Now, in the pathophysiology of hiatus hernia, first hiatus hernia pathophysiology. We will see each of the hernias in detail. First, type 1. In the type 1 hiatus hernia, there is upward displacement of here there is upward displacement of gastroesophageal junction is seen in the sliding hernia. So here there is upward displacement of gastroesophageal junction is seen, and as a result, if you see here, right, here the gastroesophageal junction itself is displaced above in sliding hernia. Okay, then so here there is upward displacement of gastroesophageal junction occurs mainly into the posterior mediastinum. So it is occurring into the posterior mediastinum, and the stomach is in its normal position, that is stomach is longitudinal in alignment itself, just like the normal it is longitudinal alignment is present. And in hiatus and in this type 1 hiatus hernia is associated with people with inguinal hernia. This is associated with people with inguinal hernia. That is, it is associated with inguinal hernias. That is, if the patient has inguinal hernias, he has increased risk of hiatus hernia. So there is increased risk of hiatus hernia is seen in inguinal hernia patients. Then majority of patients of this hiatus hernia are asymptomatic, and this hiatus hernia will also correlate with the reflex disease that the patient has. So the hiatus hernia will correlate with increasing severity of reflex disease.
thank you and thank you for watching.